Now, following Neil Wallace's article in Farmers Weekly this week, titled Political Parties Debate Rural Healthcare, it has come to our attention that the rural health workforce is crying out in crisis, facing the shortage of doctors, nurses and health professionals. And this is following a recent New Zealand Rural General Practice Network webinar, whereby 4 of the political parties were put to the test. Why should we have to rely on health professionals from overseas, as it's not sustainable and a new approach is urgently needed? Joining us now is Dr Anthea Prentice, who's been a rural GP in Cheviot, North Canterbury, for over 25 years. Welcome to Sarah's Country, Anthea. It's a privilege to have you on the show.
Thank you, Sarah. Yes.
I do have to make a disclaimer that Anthea's beautiful daughter Tessa has recently joined the Serious Country team as my editorial producer, taking the weight off my shoulders. Anthea, it's a privilege to have you as her mother on the show. And before we get into the topic of this evening, she's going really well.
That's very good to hear. Thank you, Sarah. Yes.
Now, of course, Cheviot's just up the road from Christchurch, and you've been in the medical profession, and particularly in the Cheviot area, for 25 years. After listening to the feedback that you heard and the policies that may have differed between the different parties on the webinar, do any of these political parties get the crisis that rural GPs are under?
I think I did hear quite a lot of them did seem to be understanding. They kind of understand some of the difficulties. They understand that there's a shortage of workforce. They're working on plans that will bring that workforce pipeline through. So we do have some rural GPs coming through. But it's not just doctors, obviously, Sarah, is it? It's nurses, it's all our allied health professionals. I think it would be nice to see whoever got into government understanding that there's 700,000 people who live in rural England, and that makes us as big as our second biggest city. And, we do have it's very dispersed, and we do need to be looking more broadly for solutions to some of our problems. And I think if whatever policies and decisions come through government, they need to be looked through a rural lens and how to affect that rural population.
Looking through a rural lens, is it just money that is the reason why we can't attract more of these health professionals to live and work, or is it a lot more intangibles that we need to make more attractive?
I think across the board, rural GPs don't earn quite as much as our urban counterparts. I think that's partly because of that population and the travel and the distances, and also because of providing that 24-hour emergency and after-hours cover. I think there's other ways, though. It's such a satisfying and interesting career, and it can be a lot of fun too. You get to know your patients really well, and you get to do a lot of interesting things and see a lot of interesting situations, and you're very involved in the community. I think the way medical students are trained in those big tertiary hospitals where they've got a lot of collegiality support and have every diagnostic modality, CT, MRI at their fingertips, it can be a bit daunting to go into those smaller teams where you might be just one of the small making decisions about patients. And so I think those undergraduates, those students, need to be encouraged out into the rural settings where they can really see the benefits and understand how it works and be part of that team and get the benefits of that. Because otherwise, I think if you come up through the hospital system, you get into your specialties, you don't really look at general practice, or especially rural general practice, where it's perceived as being quite hard, quite difficult to be on call, and we've heard a lot about the drain and the burnout. It'd be good to hear a few more positive things about the way it plays out in real life.
It would be wonderful to hear a policy announcement around, well, I mean, it wouldn't necessarily be a policy announcement or a concept around compulsory rural placement and part of the training, because it's not only the encouragement of once they've lived the lifestyle and understand it, they may be more attracted to it, but it's also at the end in terms of in the city hospitals, when we have an emergency out in rural New Zealand, that they have compassion to understand what they're dealing with and where that patient is coming from in that environment.
That's right, and understand the distances involved. And so that, if there's an accident in Cheviot or a couple of hours from a big base hospital, you have to be, you're supporting volunteer St John's, it's the volunteer fire guys that are there directing traffic and with the jaws of life. Yeah, it's a big team approach, and I think getting those, you're absolutely right, Sarah, getting those students out into the rural setting, there isn't, they are trying to bring that in. Medical students do spend a few weeks in general practice, and as part of that, they are supposed to spend a bit of time in rural practice, which is good. But I think also encouraging rural people into medical, become nurses and become doctors, because those people understand rural communities. They're from rural communities. They love that small town New Zealand, and getting them into those training programs, because that has been shown, research has shown that those people are the people who come back and are happy to be in those rural settings.
And it has been something of our generations where teachers and nurses have come from rural areas and returned to rural areas, marrying local farmers and being an active part of the community for a long time in terms of its sense of well-being. It certainly does work. When it comes to the shift in our population back out into the regions, and this is following the COVID pandemic lockdown, and the biggest cry was coming out of the rural health profession saying, you're sending all these people out to their batches, but we don't have the ability to cope with this pandemic. Was that listened to?
Yes, there were. I mean, the other side of that, of course, is is having the rural broadband, the connectivity, not just the cell phone coverage, but the broadband. And I think that's a big consideration for anyone living rurally. I mean, if you work on a dairy farm, one of the first questions you'll ask is, what's your internet like? What's your coverage? My children like to watch Netflix or whatever. So it's quite an important consideration. And I think the government and all the political parties are working towards bringing out better broadband coverage. But there are still some real dark black spots, and there's not adequate coverage. And with COVID, of course, when we weren't able to do as many in-person consultations, we really relied on that, those video consults or that telephone consults. We did get a few. I mean, I think people did go to their batches, but it was quite well policed as well. A lot of people then drifted back to their cities because it's there just wasn't enough medical staff, and even just the supermarkets and all that sort of thing. You couldn't cope with the influx of all the people. So yeah, I think people did eventually drift back.
Now, of course, we're talking to GP Dr Anthea Prentice from Cheviot. 25 years in rural GP, and there was a recent webinar. I'm just bringing up there, but the Greens, Julian Genter, has claimed that the inequalities of rural health are linked to climate change, agricultural policy, food production, and social inequality. Are the Greens extremely disconnected to the rural health crisis from those comments?
I suppose we all live in the environment, so we all have to be mindful of the climate change, but I think their push is sort of tax more and spend more money. I do think the idea of decentralising, not having everything in the big cities, and giving the healthcare to the rural people who are actually in these rural settings, and they know what they need if they get an opportunity to provide it locally where it's most needed. So we're not getting in our cars or using that ambulance, taking the ambulance out of the area for the 4 hours or whatever that it takes to transport a patient through to the base hospital. So, I mean, we're all aware of climate change, and we all have to be mindful of using our resources wisely and really providing healthcare where it's most needed by people who can provide it well in their communities is probably the best answer.
And from this article in Farmers Weekly, compiled by Neil Wallace, there is a lot of comparisons to some things that are working internationally with the United Kingdom's National Health Service, and suggestions by Dr Shane Reedy from the National Party about some of his experiences from Canada and Australia. Anthea, what are some of the examples you've seen that you'd like to see here in rural general practice?
I do think getting that virtual connectivity with virtual consultations could be really useful as a good tool for liaising and having specialist appointments in the hospital so that people don't have to travel. We could have people coming more rural involvement in the training and in the general practice setting. I think probably just being overall a little bit more positive and not focusing too much on the drain and the burnout of rural GPs, but talking about the wonderful small town museum, which is providing the agriculture and the fishing and the horticulture and the really is accounting for a big part of our income as a GDP of our country. So we have to start being a little bit more positive and hopefully that will filter through and allow people to see the benefits of being a rural GP.
And tomorrow night, 7:00, we have Sarah's Country's election special, where one of the questions I will put to the 5 agricultural policy spokespeople is what will they do about rural broadband and its impact on rural health. Anthea, you'll have to tune in at 7:00 and watch that in more detail. Before we go, Anthea, in terms of the lifestyle of living in the most beautiful part of the world that you do, north of Cheviot, on the New Zealand coastline, is absolutely incredible and a beautiful place to raise your children and farm in New Zealand. But it also comes with its natural disasters as well, and the resilience that your family have had to show through the Kaikoura earthquakes. We're talking tonight about interior design and grand designs and things like that, but you had to do it out of choice. Would you be able to share with us your story and journey on that front?
We did, Sarah. So the night of that Kaikoura earthquake, and Tessa at home with us, daughter, our house was very badly affected by that 7.8 quake, and in fact it was unlivable and was more or less shaken to the ground around us. So we were very lucky to survive that episode, and from that we are now looking at rebuilding one day. I don't think it'll be a grand designs. We have obviously built a smallish place to live in, and one day we hope to rebuild on that lovely site. But unfortunately with the earthquake came quite a lot of land damage, deep fissures and cracks through the ground where our house was, and so the house had to be fully demolished, and there's really not a lot of sign of it there. And a lot of our section of the house, the garden, has actually been carted away because it was deemed unsafe. So yes, it was definitely a life-changing event for us and our family. But one day we hope to rebuild, and actually my son is getting married in January on that site, so that's rather lovely.
Oh.
It's spurred us on to tidying it all up.
Oh, wonderful. There is always, the sunshine out of a storm. Anthea, and I mean, I can just see you when you're in your new kitchen one day and go, oh, golly, who would have ever thought I would have had one of those, So, and yes, and
exactly.
Yeah, absolutely. Silver lining. Thank you so much, Dr Anthea Prentice there joining us from Cheviot, head of the New Zealand Rural General Practice Network's webinar with the political leaders. This is Sarah's Country.